And with that, we will go ahead and move forward. There we are. So what is Medicare? Medicare is a federal health insurance program for people who are turning 65. So if you're turning 65, you will be eligible for Medicare. And you could also potentially become eligible for Medicare if you are receiving a Social Security disability check under the age of 65. You would have to receive that check for a period of 24 months, but you would automatically become eligible for Medicare due to disability. You also become eligible if you have end-stage renal disease, so kidney failure, okay? But in general, today we will be focusing on Medicare at age 65. Generally, Medicare, it will work all the same for anyone who is qualified and eligible for it, but we're gonna focus on what happens when you're aging in at 65 today, okay? The first thing I like to always cover is Medicare versus Medicaid, because sometimes people get confused by that. The two words are very similar. The easiest way to keep in mind a differentiation is that Medicaid is aid for people who lack income and resource levels, okay? So you would have to be low income, have low resource levels or assets to access if you needed medical care. Whereas Medicare is not income or asset based in order to qualify. It's a social insurance program available through the government, okay? Now there are parts of Medicare. A and B are the original parts of Medicare. They've been around about 60 years now. A is where your hospital coverage comes into play, and B are your doctors and outpatient services. It is referred to as your medical coverage. And then we have C and D. They were added in 2006, basically to give people other options if they didn't realize that they only had a certain amount of time to pick up additional coverage to help pay for what Medicare doesn't pay for, okay? So Medicare is really about enrollment periods and qualifying during those enrollment periods. So we'll be focused a lot on that, on time frames that you can take care of what you need to for Medicare. C and D also came about to help make sure prescription medications were covered, because previously they just didn't have a lot of medication coverage. But no matter what you do, you will have to pick up A and B when you decide that you're going to retire and you need to move to Medicare. We'll also talk about whether or not you need to pick them up if you are still working, okay? So we'll be getting into that. So as of 2022, when you enroll in Part A, as long as you've worked for 10 years or 40 quarters is how they qualify it, and pay Medicare taxes, you will pay no premium for that. So you will have a zero premium for Part A. Now, as you would go to the hospital, you would pay costs. So the first 60 days in the hospital is $1,556. If you are still in the hospital day 61, you begin a copay of $389 a day. And then days 91 through 150, it is $778 a day. So it gets rather steep. Those last 60 days are what they refer to as lifetime reserve days, meaning if you were in the hospital 100 days and you use 10 of them, you would have 50 more days to use past your 90th day in the hospital, okay? So once you use up those 60 days, basically Medicare would come in and pay for future hospitalizations only days 1 through 90, okay? But this first amount is a deductible for 60 days, and then you go to a copay per day cost. So that gets a little confusing because this $1,556 can be paid multiple times in 1 year, okay? Part A also covers hospice care. It covers blood as far as transfusions. although you would be responsible for paying for the first 3 pints of blood. And then potentially you have access to 100 days of skilled nursing. You would be required to have an inpatient hospital admission for 3 nights prior to going to the skilled nursing. And days 1 through 20 are paid very well. Days 21 through 100 have a large copay per day. It is not designed to cover chronic long-term care under Medicare, okay? So these would be short-term stays in a skilled nursing facility. So possibly just more intense rehab is needed after an incident. Okay, so that's part A. Part B is where your doctors and outpatient services come into play. And everyone pays at least the minimum $170.10 a month for Part B. There are some qualifications, say under Medicaid, where that could be waived entirely. We see a lot of commercials that talk about waiving that. Generally, that's if you are Medicare and Medicaid eligible both. There are some discounts for Part B if you are a veteran and utilize the Veterans Affairs for medical needs as well. But otherwise, majority of the population will pay at least $170.10 a month for your Part B. Now I have a note here that says IRMA. That stands for Income Related Monthly Adjustment Amounts. They always do a 2-year look back on your income to determine if you will pay this base premium. If you are an individual tax filer and 2 years ago, your income was above $91,000, the gross amount, then you will pay a higher amount for Part B. If you file taxes as a joint tax filer, they will look at $182,000. Okay. So just keep in mind, you could pay more than this if your income was higher. It's always a 2-year look back. So the next year they would be looking 2 years back again. So if as you've retired and moved further away from your retirement, your income goes down, your premium could get back to the base level. Okay. Part B, when you need services, if you go to the doctor or have an outpatient procedure, you need chemotherapy, you need immunotherapy, those things are all covered under Part B. You would pay the first $233 towards that care. Then Medicare begins paying 80% of your claims, and you would pay 20% of the claims. And they always work off of the Medicare negotiated rates. Okay. Now, a key thing with original Medicare A and B is that there is no maximum out of pocket. So most people are used to being on a group plan where you might have a deductible, then you go to coinsurance to a maximum out of pocket. Under Medicare, you would just continually pay these costs. There is no maximum out of pocket, which is why generally people will look at additional coverage to add on. But no matter what you would do, you would need to have A and B in order to get the additional coverage. I do also want to point out that Part B is one area where you could be penalized, okay? That penalty is 10% of the $170.10 for every 12-month period you went without Part B, and you should have picked it up when required. Now, it is important to know if you are still working, you have employer coverage, you do not have to pick up Part A or Part B at all if you have employer coverage. However, later on, we will get into a slide where we talk about the size of the employer, because sometimes under 20 employees, you need to pick up B. But if you didn't, you still wouldn't face that penalty as long as you have employer coverage. Now, COBRA will not keep you from the penalty. So once you're Medicare eligible, you should not be on the COBRA health insurance plan, okay? If you would happen to be on a marketplace plan or the ACA coverage, that would not keep you from the Part B penalty either, okay? So it's important to understand when you will need to pick up A and B, and we'll get into those details here in a little bit. Part C is an Advantage plan. I mentioned these came about in 2006. Part C is optional. You don't have to choose Part C when you retire. It's just one of the plan designs available to you. These plans would pay claims instead of original Medicare A and B, but you still have to be enrolled in A and B. Okay. Basically, that Part B premium of $170.10, the government is going to dole out to the private insurance carrier as claims are filed. Okay. Most of the plans do incorporate your drug coverage into the plan. So they are usually a comprehensive plan with health and drug all combined. And it will replace the schedule of benefits that I showed you on the prior screen under A and B. They will set their own copays or coinsurance amounts for care. They're required to have a maximum out-of-pocket limit on them, but you will have a network of doctors that you can see. Some plans might only even provide you in-network access to doctors. And if you see a doctor that's not in network, you would pay 100% of the bill. Okay. Advantage plans do have an annual enrollment period. So the plans do adjust year to year. They're all calendar year based. So January 1 through December 31st. And if you are on an Advantage plan and you want to switch to a new one, you can do so between October 15th and December 7th. And again, that would start January 1. Okay. So just keep in mind, Advantage plans are another way to access coverage, and they'll structure out the benefits for you through the private insurance company. Okay. Part D is the prescription drug coverage. I've already mentioned if you go with an Advantage plan, most of them will incorporate the Part D. Okay. Otherwise, if you just had original Medicare A and B, you would likely pick up a standard standalone drug plan. These plans also adjust every year, and you can change your plan year to year during the annual enrollment period. Okay. It is also very important to understand that if you are leaving employer coverage and you don't pick up a qualifying drug plan, you will later on be penalized when you go to pick one up. You could also face a penalty for Part D if once you are eligible for Medicare. So let's say at 65, you're eligible for Medicare, you work till your full retirement age of 66 and a half. You will need to ask your employer before you turn 65 if the drug coverage included in your group plan is considered creditable for Part D Medicare. If it is not, when you would go to retire and pick up a drug plan, you would then be penalized. You cannot pick up a standalone drug plan and remain on your group coverage in most states. And I say most states because there are a few states that have removed the drug coverage from their plan, and they're allowing that for someone Medicare eligible to pick up a standalone plan, but in most states you cannot. Okay. So the penalty, it is assessed by taking 1% of the national average price of a drug plan. Okay, that national average price is currently $33. So they take 33 cents times the number of months that you went without a drug plan and should have had one, and that amount is charged to you every month for the rest of your life. If the average price of a drug plan changes the next year, your penalty will adjust. Okay, so it is a lifetime penalty. But let's say you don't pick a plan for 10 months and they take that 33 cents times 10 months, $3.30, you would pay extra every month for the rest of your life. Okay, so it is very important to understand, number one, when you're still working, ask your employer or look for your creditable coverage notice that you received from them to determine whether or not you have to be concerned about the penalty. And if you are retiring and moving to Medicare, don't skip getting a drug plan, even if you don't take medications. Okay, you can get them pretty inexpensively. $33 is the average price. However, we have plans much less expensive if you're not taking medications. Okay, so that is Part D. Before we go too far, I'm going to check questions. I do see here in the chat bar, there is one that is asking, do we know if Purdue's insurance is considered creditable? So if you are an employee of Purdue University, all 3 plans that they offer are currently creditable for Part D, okay? So they are currently creditable, and I use the word currently because plans change year to year a little bit, and so that could change. It is something you would need to verify each year, okay? But currently they are creditable. Terrific question. So it's not clear what the Advantage Part C is. I will actually go into some more details on Part C on a future slide. And then I also see some additional questions about timeline, and we're getting ready to cover that next. So I will look back at that. And if there are any questions that haven't been covered, I will make sure I address them after that point. Okay. Someone did ask here, how do we find out if our employer's plan are creditable? You would want to talk to your human resources. If your company is small and you don't have much of a human resources, you might just talk to the controller at the company or whoever helps with your benefits there. If they do not know, they should go to the broker who helps with the health insurance plan, okay? And they will be able to get that. Every year, the Center for Medicare and Medicaid Services evaluates the group plans to determine. So then say, for example, Anthem will have a chart of all their plans and whether they're considered creditable. Creditable just means that they cover as well as a Medicare plan does. Okay. All right. So I think the rest of them, I'll be covering like the timeline and what is a Medigap policy in the next few slides. But don't hesitate. If I don't answer that when we stop in the future, let me know, okay? All right, so when can I sign up for Medicare? So let's first address if you're just turning 65. You have a window of time of 7 months that you can enroll in your Medicare and not have to worry about getting extra paperwork, okay? Now, that window opens 3 months prior to the month of your 65th birthday. So if your birthday is the 2nd through the last day of the month, you will always start your Medicare the 1st day of the month you turn 65. If you're a lucky one to have your birthday on the 1st day of a month, your Medicare starts 1 month earlier. So if you had a July 1st birthday, Medicare would begin on June 1st. If you have a July 2nd birthday, Medicare begins July 2nd or July 1st, sorry. So just keep in mind, it doesn't matter if your birthday is July 31st, you're still eligible to begin July 1, okay? Now, this chart shows that 7-month period. What I want you to be aware of is that this ECX column here is referring to the month that you turn 65 and become Medicare eligible, or 1st of the month before if your birthday's on the 1st. You can take the 3 months before to take care of enrollment. So this X stands for the month that you go through the enrollment process. C stands for 1st month of coverage, but it's really referring to Part B, because if you enroll anytime in these 7 months, your Part A will always begin the 1st of the month that you turn 65, but your Part B would not start until a later time if you don't enroll in the 3 months prior. This becomes very important to be aware of if you are deciding to retire in the few months after your birthday. It's not uncommon for me to have someone come to me and say, well, I turned 65 July 30th. So I won't be eligible for Medicare until the end of the month. I'm just going to retire and start my Medicare August 1st. And that's fine. Just keep in mind, if you enroll too many months ahead, you'll go ahead and pay for your Part B July 1. You really could retire at the end of June in that scenario. Okay. If you're retiring in the months after, there are 2 months in which I cannot get you to Part B. Okay. And this is not me making these rules or anything. This is the government. Your initial enrollment into A and B does happen through Social Security. Okay. So this will happen through Social Security. You can either enroll online, you can call and make a phone appointment, you can go to the office now. They did open up April 7th for in-person drop-ins. Okay. So just keep in mind, you would enroll through the Social Security office, and this is your timeline if you're turning 65. So be cognizant of it if you think you're going to retire in the few months following. Now, if you want to retire more than 3 months after you turn 65, you're still working, okay? You can do that. You don't have to pick up Medicare at 65 if you're still working, okay? So at retirement, you can start the process 3 months prior to the date that you need to start your Medicare and those health benefits so that you don't lapse any coverage, okay? Number one important thing to ask your employer, if you stop working in the middle of the month, do you lose your benefits that day, or do you lose them at the end of the month? So someone already asked me about Purdue University. If you stop working on the 20th day of the month, that's the day that you lose your benefits with them, okay? So you have to be a little strategic about that. So just keep that in mind. Now, you also have 2 months after the last day that you had employer coverage to get enrolled and not have to worry about any kind of penalty. Some items you actually have up to 8 months to make that change and get enrolled in. However, the Part D penalty will start racking up if you've gone more than 63 days without qualifying drug coverage. Okay. So it's important to make sure that you have qualifying drug coverage within 2 months of retirement. Okay. Now let's look at an example here. In this scenario, someone loses their health benefits through work on May 31st. They want to start Medicare June 1st. They have 3 months prior that they can go ahead and start that process. If you are over 65 by more than 3 months and moving to Medicare, there are additional forms that have to be completed in order to pick up Medicare, okay? One of these forms is an employer verification form. It's called the L564 form, and your employer will need to fill that out. If you are someone who is working and now fully wanting to move to Medicare and you're say 75 and you've had 2 different employers since you were 65, you will need each of those employers to fill out that form for you. So any employer you have had since age 65 will need to fill out the employer verification form for you. Okay. You also will need a Part B enrollment form. It's called the CMS 40B. Okay. Both of those forms go to the Social Security office, and this is your first step in the process in transitioning to Medicare, because you must have your A and B and we must have a Medicare number before you can choose your additional coverage. Okay. All right. So we're going to move to the next slide. And I think I already actually have a question here from someone that I think this slide will answer that question. The question is, this person turned 65 this year and will have health insurance through his wife's employer. They are also contributing to the HSA. Should they continue this strategy until she retires in a few years and then both sign up for A and B? So where this slide coincides with that question is that if you take Part A Medicare, you need to stop your HSA contributions, okay? So once a person has enrolled in Part A, they are no longer eligible to make HSA contributions. Now, you're not going to go to jail if you have accidentally done this, okay? But you will pay tax as ordinary income tax on those contributions. So it is advised at the very minimum that you stop your own contributions if you happen to pick up Part A. Now, something that is a real myth, because a lot of papers you will get in the mail, which are actually advertisements, are telling you, you have to get enrolled, you have to get enrolled. If you have not elected Social Security and you are still employed or have health insurance through a spouse who's employed, and that employer has more than 20 employees, you don't necessarily have to pick up Part A. You have to pick up Part A if you've elected to take a Social Security check. So once you take Social Security, you have to take Part A, but you don't necessarily have to pick up B yet either, okay? So I see that scenario where a spouse is on the plan, the health plan through a working spouse, okay? They might have started Social Security on their own. They get Part A. It doesn't mean they can't be on that HSA qualified plan. You might just have to limit your contributions to an individual maximum for the year, okay? So with going with this philosophy here, if you are working for a large employer and you still want to be contributing, you're happy with your health plan, I would say stay on that plan unless you're paying an exorbitant premium, and you don't need to pick up A and B typically. Okay, but this is where it could vary depending on size of employer. Do you typically have health conditions that cause you to meet that deductible, or are you paying an excessive premium for that plan? Okay, so a lot can go into weighing that decision, but these statements here are a fact. You don't have to pick up Part A at 65 if you're still on employer coverage, unless you've elected Social Security. Okay, all right. I do have a question here from someone. If I work past 65, must I still register with Medicare by 65? No, you do not. You don't have to register with them. Okay. All right. I also, let's see, I have a question. I'm not retired, but my husband is, and I'm still contributing to the HSA. Is that okay? That is definitely okay. I would just recommend that you keep it to the individual contribution limits, okay, which 4,600 would be that maximum individual. It's 3,600 plus 1,000 if you're over 55, okay? So you can still contribute. I'm assuming in that situation, your husband being retired may already have Part A, okay? All right, and likewise, I have a question here about widow's benefits. If you're taking widow's benefits, you are automatically qualified for Part A as well. Okay. All right. So, you know what, let me address a couple other questions here. Turning 65 in February, currently covered for medical with wife's plan. How can I stop receiving Medicare Part B benefits? You would contact the Social Security office in order to decline Part B. Now, you only want to do that if your employer has more than 20 employees, okay? But you can do that. You just have to talk to Social Security about declining it. There's no reason to pay that premium if you're over 20 employees. All right. And so let's go ahead and talk about your options. So at this point, you've picked up A and B, you know you're retiring, you have two options to choose from in order to have full coverage and make sure you're avoiding all the penalties. One is to choose a Medicare supplement. It is also known as a Medigap plan, so they are the same thing. When you do this, you also pick up a standalone Part D plan for coverage. Your second option is a Medicare Advantage plan, okay? So those are your two options to have full coverage. We're going to first address the Medicare supplement, also known as Medigap, which is part of option 1. This chart is all the Medigap, Medicare supplement plans available to you, okay? Now keep in mind, these are plans. Earlier when I showed the A, B, C, and D, I don't know if anyone caught it, but I emphasized the word parts, okay? Because you have to get A and B, part A and B, in order to pick up a supplement. We're going to go ahead and narrow this down to a couple of the most popular plans because they're your better value. It used to be, however, that Plan F was very popular. However, if you were born 1955 and later, you cannot enroll in C or F. F was popular because it picked up all costs that Medicare didn't pay, okay? With the exception of the prescriptions, of course, but it picked up all the medical costs under your hospital or doctors and outpatient. Currently, we see more people choosing G if they're really looking for comprehensive coverage. G covers everything but the Part B deductible, which is currently $233 a year. The second most popular plan is N. It's very similar in the fact that you would still have to pay your Part B deductible of $233. So you pay that towards doctors and outpatient services. And you do have a potential for excess charges if you ever see a doctor that doesn't contract to take Medicare, but they're seeing you for something Medicare will cover, okay? Pretty rare to occur because most doctors do take Medicare. Less than 4% of doctors across the country don't take Medicare. Key difference on N is there are some copays. You pay a $20 copayment for a primary doctor visit and $50 if you go to the emergency room. All right. The third plan we'll see is this G1 here, and G1 is a high deductible G. Oftentimes people who have had health savings accounts will consider a high deductible G. You would pay the first $2,490, and then that plan will cover 100% of the remaining medical cost, okay? So you would cost share with A and B according to that schedule I had on a prior slide, the $1,556, for example. If you go to the hospital, you would pay that and it would count towards your $2,490. Okay. Now, along with a supplement plan, and excuse me, before I move off this slide, I do want to mention all supplemental plans allow you to see any doctor that takes Medicare. So you can see any doctor that takes Medicare, whatever state you are in, or the 5 territories that take it. You do not have a network of providers to be concerned with, okay? Now, along with that, you do have to pick up the drug plan. Average is $33 a month. There is a tool on Medicare.gov that anyone has access to, okay? It's not the most intuitive, but you can go in there and find the plans. It will show you drug plans by entering a zip code. It will confirm the county you live in because these are very county specific. You will have a list of medications that you would enter, very detailed with your dosages. How many tablets do you take a day of each? Do you pick up a 30 or 90-day supply? That type of information. You'll even enter your pharmacy. And this is something that we do regularly for our clients to help them make sure they're in the best plan possible. But anyone does have access to this tool, okay? You do have an annual enrollment period with drug coverage. So each year, if you want to change your drug plan, you may do so, okay? And it would start January 1st. Now, likewise, a supplement, the first part of this option, there is no annual enrollment period. You can get into a supplement guaranteed, whichever plan of your choice, within 6 months of picking up Part B. Outside of that, if you've had A and B both while you're still working, you have a 3-month window once you lose the employer coverage. But if you are on a supplement, and let's say you take the high deductible G and now you want the traditional G that covers more, you will have to answer medical questions in order to change plans. So one of the biggest myths, because of all those commercials where you can, hey, it's time to change your plan, make sure you do it by December 7th. You cannot do that with supplemental unless you're willing to go through medical underwriting questions. Okay, so keep in mind, you can change your Part D easily. Now, if you are on option 1 and you want to switch to an Advantage, that's something we'll address here in a minute as well. Option 1, this is just to give you an idea. I will tell you, I know we probably have people from multiple states here. I am in the state of Indiana, just across the river from Leslie in Lafayette, Indiana. These are premiums for Indiana. They're just some averages. You see the Part B there. I've used the average Part D. And then these are average G plan premiums. Basically, this plan here on the left, if you are new to Medicare, turning 65, and you're a non-smoker, I would tell somebody if you want the most comprehensive coverage, in total, you should spend about $330 a month. You'd have very little out of pocket, and copays depend on your medicines. Now I have the high deductible G option over here. You can see low premium, but you have a deductible to meet. The N plan is in the middle. It's a little closer to the G premium because it does cover all costs if you're at the hospital. Okay, so this just gives you a perspective here. Okay. Now, option 2 is Medicare Advantage. And I did have a question on here earlier about, Medicare Advantage. It's kind of hard to understand some of the descriptions on them. Many people do refer to them as replacement plans. It is because they replace the benefits under A and B Medicare. But what's confusing is you have to be enrolled in A and B in order to enroll in an Advantage plan. But what will happen is they will set up their own copays and coinsurance. The government requires that they pay at least what Medicare A and B cover. So for example, under Part B services, they have to cover at least 80% of the cost if you are at an in-network provider. Out of network, if the plan offers out of network options, you'll pay usually somewhere 40 to 50% of the claim, okay? So the plan will then set an out-of-pocket maximum that you would potentially pay for the year. Keep in mind, these plans will have networks, and some plans have in-network only benefits. These plans are very different county to county, state to state. You will see major differences, especially state to state, okay? In our area, we have a plan that, here is no premium, and the county next door is almost $50. So, they can really vary. It's important you do have to enroll in the county that you reside in, whatever place Social Security has for your address, okay? Again, they change yearly, so the benefit structure may change. In September, you will always receive an annual notice of change, and if you decide you want to switch plans, you can do so between these dates. If you don't want to switch plans, you're happy with your coverage, then you don't have to do anything. Your plan will roll over. Just pay attention on that annual notice of change if your premium is going to be adjusting, okay? What people love about Medicare Advantage plans are the perks. They all offer gym memberships. They'll have maybe some dental cleanings, some money towards new glasses. You might get some over-the-counter dollars to spend towards things like vitamins or Band-Aids, gauze, a knee brace. So they have a lot of perks. Those perks help balance out your potential out-of-pocket, okay? So hopefully that helped explain a little more what the Advantage plan is, okay? I know it can be rather confusing, but essentially you can either choose to have an Advantage plan along with your A and B, and it will replace the A and B benefits, or you can choose a supplement with a standalone drug plan, okay? Now, the Advantage plans, There we are. A key component with them, I mentioned they are county specific for premium. They are the same whether you're male, female, you're 65 or 85, if you use tobacco or don't use tobacco. You pay the same premium depending on where you live. Now, I have a couple examples here for you of potential plan options that you could see. You will see some zero premium options here. So I'll hear from a lot of people, hey, I don't pay anything for my plan. I don't pay anything at all. They're definitely still paying Part B. But because Part B will come out of your Social Security check, if you're taking Social Security, a lot of people forget about that, okay? Some plans will have a premium, okay? And then you'll see you'll have deductibles, copays. You might have a deductible for the certain medication tiers. All drug plans have a formulary of what medications they cover, okay? And then you'll have maximum out-of-pocket limits. Again, those will vary county to county, okay? So hopefully that helps you understand that. Now I'm going to pause a minute and make sure I've answered. I've seen some more questions come through here. I want to make sure I have someone, wife 67, he's 63, but still working. The wife is covered by the employer and did not take Medicare. Will she be subject to penalties when she does take Medicare after he retires? She will not, as long as your drug coverage is creditable, okay? So the only potential penalties she could face would be under Part D for the drug coverage. Just verify with the employer if the plan is creditable, okay? I addressed the considering the HSA contributions. All right, someone is retired and the amount they pay for the ACA insurance, so ACA is the Marketplace Affordable Care Act, is significantly less than this person will pay for Medicare. Does it make sense to continue my current policy? I may not qualify for Medicaid because of the amount in savings and being a homeowner. Okay, so what you need to know in this scenario, if you have Affordable Care Act coverage and you are becoming Medicare eligible, if you're paying a lower premium, receiving a subsidy, once you become Medicare eligible, you are no longer eligible for the subsidy. So if you stay on that plan and you don't report your Medicare eligibility, at the end of the year, you will pay back all subsidy when you file your taxes. My advice is you need to just move to Medicare immediately at 65, okay? Because your ACA insurance, if you're getting a lot of subsidy and maybe paying less than $100, if full price is $700 for that plan, you'll pay the $700 because you'll pay that $600 back when you go to file taxes, okay? So definitely if you're on ACA coverage, you need to move to Medicare at 65. I also have a question about, are the costs for Part B based on per person? Is there a family discount? There is not a family discount for Part B. Each person will pay $170.10. The only potential discounts you could see under Medicare options will be on supplements if both you and a spouse choose the same carrier. No other plans offer discounts, okay? So Part B is per person. All this time, if you as a couple have been on a group plan together, you maybe even have a family deductible or max out of pocket, nothing is looked at together except for your income to determine if you need an IRMA charge. That is the only thing, okay? All right, let me make sure. I think I've almost got through some of these. Somebody, again, husband is 66, currently on an insurance plan where she is employed. He's registered for Part A and starting Social Security. You do need to stop or you need not necessarily stop your HSA contributions, but review them to make sure as a whole you're staying under the individual contribution limits. Okay. So someone asked here as well, and I'm going to slide back to a timeline here. So a spouse is 67, covered under an employer plan, signed up for Medicare to start Part B in March. He would have 6 months from March to pick up a Medigap plan guarantee. He cannot have the Medicare supplement or Medigap plan and an employer plan at the same time. So you cannot have a Medicare supplement, Part D, or an Advantage plan and an employer plan overlapping, not even for one day. Okay, so 6 months in that scenario. Someone also asked if you are moving to a new state. If you're moving to a new state, you have a 60-day window to change your plan. You only have to change Part C or D. A supplement is good in any state. You do have to report your new address, so you may get a change in premium. Not all plans change the premium for different states, or not all carriers, I should say. All right. So hopefully that gave you an idea. You have a 60-day window. That window when you move is triggered by your report to Social Security of your new address. All right, I want to move forward here on who pays first. So if you are 65 or older, and let's say you're still on a group plan, maybe you're on a spouse's group plan, and you've picked up Part A, if there are 20 or more employees, the group health plan will always be primary. If this applies to you, there is no need for you to be paying a Part B premium. You could have Part A. If you're on a copay style plan, I would definitely recommend you pick up Part A. If you're on a health savings account style plan, if you're contributing, more than the individual maximum, then the spouse would definitely want to maybe not pick up Part A yet. But if you're under that maximum, if it's a spouse over 65, then they could go ahead and pick up Part A. Okay, so just keep in mind the group health plan will always pay first. Now, if you have fewer than 20 employees, so 19 or less, Medicare pays first. In this scenario, since 2014, every health certificate that I have read demands that people pick up A and B. So even if you're on a health savings account style plan, okay, it will require that you pick up Part A and B, because the plan will only pay benefits as if you have them. Basically, your group plan through the employer would act as a supplement. If you have under 20 employees, I would evaluate what kind of premium you're paying. If you're not covering a younger spouse, you may be better off just moving to Medicare entirely versus the group plan. But that's something you would have to evaluate, which premium is less. Okay. And then let's talk about if you're on Medicare due to disability and under 65, rules are similar, only they use the number 100 employees. So if it's 100 employees or more, the group health plan pays first. Again, you don't need that Part B if you're eligible for Medicare due to disability. But if it's fewer than 100 employees, you're going to need to keep that Part B in most circumstances. Again, ask your HR for the health certificate and confirm that information. Okay. I'm going to briefly touch on this. Luckily, over the last couple of years, we've seen fewer and fewer people affected by this, but I always used to get questions on what's the donut hole. They might have a friend who hits the donut hole and it sounds terrible. I'm paying a lot more for my meds. Prescription drug payment stages are on every drug plan under Medicare. Okay. So they calculate what you and the insurance company pay up to $4,430. Once you reach that, you pay 25% of the full cost of a medication. Now, the medications that will get you there are going to be maybe like a Trulicity that's $800 full price. You might pay the first $480 in the deductible, and then you'll go to maybe paying $50 a month for it. But once you get about what, 5-6 months into the year, you will then, because they're counting what you and insurance pay, you then start paying $200 a month for that medicine. Okay. This stage, wherever you are in that stage, will be calculated out by that Medicare.gov tool. Okay. So it will map out your full cost for you, so you know what to expect. So I just want people to realize all qualifying Medicare drug plans have these stages. Okay. While we're on that topic, Part D, I have a lot of people ask about like the GoodRx or the Script Save. You could use those instead, but they're not going to cause you to avoid the penalty under Part D. Okay. So really, if you want it, when you're moving, you need to move entirely if you want to avoid all the penalties that can occur. Okay. All right. Just want to make sure everybody knows your first step in the process would be through Social Security. That's where you pick up your A and B benefits. And then there are a lot of resources out on the Medicare.gov site. Okay. So make sure you take advantage of these resources. There's a Medicare and You guide you can access and look through rules there. But Social Security is where you pick up A and B. They will remind you to pick up a drug plan, but they do not enroll you or really know much about your drug plan options. Okay. Do also keep in mind on the Medicare.gov site, you will find premiums for Part C Advantage plans and Part D drug plans. You will not find premiums for supplemental plans or Medigap plans there. Okay. All right. So we have just about 5 minutes left. I wanted to make sure you had access to my contact information. Also, my account executive, Dakota, is fully certified as well, and she can help you with the questions too. So if you do have any follow-up questions, feel free to take down our name and our email address here. I'm going to spend the rest of the time answering these final questions I see. So where can I go to find the tools section for Part D drug plan? And that's on the Medicare.gov site. It will say find plans. And that's where you will use the Medicare.gov plan finder tool. Okay. On this site, I don't know if you can see it very well. It's on the lower part. Now, they have been this time of year, they do a lot of updates on the Medicare.gov site because the new plans are being filed and they have to be filed by July, but we don't see any new options for 23 until October 1st. Okay. All right. So hopefully that answered that. I think I answered, if you relocate, are you required or allowed to change which plan you're on? Again, you'll get a 60-day window. Someone asked, how is coverage when you travel out of your home state? If you choose a Medicare supplement, Medigap plan, that coverage is the exact same in any state that you are in. Okay. So you can see any doctor anywhere that takes Medicare. On a Medicare Advantage plan, if it is an emergency or an urgent care visit, you'll pay a copay for that. You always have coverage. If you are out of state, let's say you're a snowbird and you're out of state, if you decide to go see, let's say you twist your knee, you want to go see an orthopedic doctor. If you have a plan that will pay in and out of network benefits, you just go to that doctor, you pay a higher copay. If you have an in-network benefit plan, you will have to call your plan and get permission to see a doctor. Sometimes they'll go ahead and agree to pay 80% of the visit. It just depends. Okay. There are circumstances where if you're on an in-network only plan, I've had people be required to return to their home state for care. Okay. Let's see. So someone says, my math on a Medicare Advantage plan is that it is a Medicare Advantage plan is less costly than Medigap. So yes, premium wise, it is less costly. If you're healthier and you won't be getting having a lot of claims, you could be money ahead. If you're someone who needs a lot of health care, you could end up being behind because the Medigap plans cover more comprehensively in most cases. Okay, so that's where that evaluation will be on what's your philosophy. Do you want to deal with the network or not deal with the network? Do you mind always having copays? If you suddenly have to go to rehab, do you mind constantly paying copays, or do you just want to be done after deductible? Okay. So someone asked on the option 2 examples, the slide said 4,900 and 10,000 for out-of-pocket max per person. Again, these are per person plans. So there is no family max. If you choose a plan with those maximums, that's yours. If your spouse chooses a different plan that has different maximums, those are their maximums. So that essentially, if you choose the same plan, you're each responsible for 4,900 or 10,000 if you're out of network. So hopefully that helps. Someone asked here, should we assume all Blue Cross Blue Shield plans are creditable? No, you should not. You do need to check with your HR. There are some plans that are not creditable. Okay, so check with your human resources. Someone asked, how much is Part A? Part A is $0 premium as long as you paid Medicare taxes for 40 quarters. Okay. Timeline question. If you have a birthday of September 15th, you are correct. There is no way to push your Medicare back to January 1. If if you're not on an employer plan and just pushing off retirement, for example. And no, your max out of pocket, if you've met it on your group plan, whatever you would choose under Medicare. So say they're eligible for Medicare September 1, you start all over. Okay. So yes, sometimes you feel like you get a little cheated that first year. All right. All right. So I know we're right here at 3 o'clock. I'm happy to keep answering if the line will be open and anybody who needs to part can leave, but I'm happy to keep answering. I think there's just a few more I maybe have missed. What do you think, Leslie?
Yeah, feel free. That's absolutely fine. I just want to thank everybody so much for coming. And if you do have questions and have to jump off the call, I know that Maria and Dakota are wonderful and would be happy to assist you outside of this call. So thank you again for joining. If you have any questions, feel free to reach out to me as well. If anything with Purdue for Life that I can assist with. But yeah, take it away, Maria, and feel free to keep answering questions as long as people are interested.
Okay, I just did not want to tie up the line if somebody else was getting ready to use it. Okay. So someone who was born in 1953, could they pick up Plan C or F? And the answer to that is yes. The only people who cannot enroll in C or F are people born 1955 and later. Okay, that was part of the macro reorganization decided in 2015. Please explain the common approach for how to cover a non-working younger spouse when the older spouse moves from employer insurance to Medicare. So there are a list really of options available that can vary depending on who you work with. You could, if your employer offers a retiree plan, you could take that retiree health insurance until age 65. Essentially, that is staying on the same group plan, but you pay the full premium. Most employers, some employers will still pay a portion. So check with your employer to see if there's an employer option. If your employer has 50 or more employees, they have to offer you COBRA. So COBRA is an option. The other option is to have an ACA plan, so the Affordable Care Act plans. That younger spouse could consider a short-term health plan. In Indiana, you can only have those for up to 3 years. Other states have different rules how long you can have them. Short-term plans, most places can deny you for pre-existing conditions, and they do not cover pre-existing conditions. The fifth option I can think of are share programs. So these are most commonly known as Christian share programs that you can access through like Samaritan group, or MediShare is another one that I've seen. So those are some others. They can deny you there, and until you've been on the plan for so long, they don't cover pre-existing. Okay, so those are really the 5 main ways of getting coverage for a younger spouse. I recommend starting with your employer and asking about retiree and COBRA costs before you explore ACA and the other options. Okay. Someone wanted to know if they can print out the PowerPoint. If you email me, I am happy to send you a PDF copy of it. So just shoot me an email and I will send you that PDF copy. You're more than welcome to print it out. I don't have a problem with that. All right. Again, somebody mentioned Part A. Part A is no cost. Again, if you've worked and paid Medicare taxes for 40 quarters. Someone asked if it's simplest to start Medicare on January 1. So if you're still working over 65, that can be the most simple option, especially if you've hit your deductible on your group plan. But of course, you might need to work a little longer to stay eligible until the end of the year. If you're leaving your employer, don't pick up COBRA. Okay, so that can be very dangerous. Can you switch between option 1 and 2? You can go from option 1 to option 2 guaranteed during the annual enrollment period. If you stay on option 2 longer than 12 months, the only way to get back to option 1 is to qualify by answering medical questions, and you can be denied. Okay. We have a couple carriers that will possibly approve but charge you a higher rate. So yes, it's easy to get from option 1 to 2. No, it is not easy to get from 2 to 1. Okay, you can get to the drug plan very easy, but not to a supplement easily. Okay, you do always have a 12-month trial on an Advantage plan if you take that first, or if you go to a supplement and choose an Advantage later, you get a 12-month. How much do Medigap prices increase annually? So they do increase each year. The average increase has been 3% for a while across all plans. If someone is in a plan F, grandfathered, you're going to see a much higher increase than that. I've also seen carriers that close the book of business and maybe they still manage that book, but they no longer offer plans. So everyone in that book of business is aging, and I've seen them go up more like 15 or 20% a month. Okay, so average across the board, across all plans, is still running at about 3%, but just be aware that's why anybody now picking up Part B, even if you were born before 1955, I actually wouldn't even suggest that you choose Plan F, because that's considered a closed book of business. We've already seen premiums go higher quicker. Okay, again, somebody just asked, can we switch between Medigap and Advantage year to year? No, you can go to Medigap, from Medigap to an Advantage, but once you've been on the Advantage longer than 12 months, you have to answer medical questions to get back to Medigap. So this person's son is on the health insurance plan. Can this person opt in for parts A and B and keep the current health insurance? Yes, you may. However, if you have more than 20 employees where you are working, or 20 or more, I wouldn't pay for Part B. You're going to be paying more than you'll see in benefits from it. And that's because your group health plan will pay first. If you have fewer than 20, then likely you will need to have A and B. Okay. All right. I think I'm about done here, unless somebody adds something else. Okay, so assistance from Dakota and I. So it is outside of the Purdue for Life organization. We're offering this presentation as an educational resource, but any certified Medicare agent cannot charge you a consultation fee. It would be against compliance rules, and a certified agent could lose their license. So we don't charge a fee for that consultation. We do just contract in Indiana, Illinois, and Michigan. We can start out a lot of the basic conversation, and then we have a forum of agents in 49 of the states. So we can help you get to someone who works just like us. Okay. We work with a large forum across the country. All right. And then I think last thing here, and I know Purdue for Life will be recording this and posting it. Someone wants to make sure they turn 65 this year. They're not retiring. They do not have to sign up for Part A as long as they're 20 or more employees. Under 20, you need to check. Okay. Yeah, I do have a question. Does your group work with clients outside of Indiana? I think I answered that. So if we're outside of those 3 states, let me know. I actually have access to people who can help you. Okay.
Maria, thank you so much.
Thank you. Thank you. Sorry it ran over, but I think found it helpful.
It's a hot topic, and it's, you know, we all have so many questions about how this works, and it changes, and it's ever evolving. And so we're just thankful for people like you that are up and current on all of this and can share your knowledge with us. So thank you again for joining us. We're grateful.
Thank you, Leslie, for having me.
Appreciate you. We'll see you next time.
Okay. Thank you.
Bye.
Take care. Bye-bye.